provide for privacy, introduce yourself. Hi, my name is Peggy. I'm going to be your nurse today. Check 2 patient identifiers. What's your date of birth?
14/7.
Are you having any pain today?
Don't really.
On a scale of 1 to 10, with 10 being the worst, can you tell me how bad it hurts?
3.
A 3. Did anything make it better?
Sitting up.
Setting up. Okay, well, let's check then. Okay. Make sure your patient's comfortable before you start. You're going to have a better examination. And then I've already done a little miniature neuro assessment because she knows who she is and where she is and her belly hurts. You can go further if they give you off questions. And then I start with the eyes. Can I take my glasses off for me? This is my pen light. Okay, I'm going to check pupil reflex on both sides. And hers are very accommodating. They're about 3 millimeters. Then you're going to check the 6 cardinal positions, and this is checking the movement, that they move bilaterally. You're checking your cranial nerves, and I can't remember the other thing right now, I'm sorry. You also want to check for nystagmus. She doesn't have any. You can check your peripheral fields if there's a question if her eyes don't move well enough. You go ahead and stick your tongue out at me. Make sure the tongue is midline. Can you smile for me? Make sure both sides of her face go up equally. You want to look at her hair and scalp. Make sure they're dry. Check for any enlarged lip nose. You're also checking for jugular vein distension, which is best done at about a 45-degree angle. You come down. You already have a set of vital signs before you start this. Okay. All right. Since I've already started the neuro, I'm going to go ahead and have her squeeze my fingers as hard as you can. Good. Continue with, finish up the neuro, and her grips are equal bilaterally. I am going to listen to her apical pulse, which is fifth intercostal space, midclavicular line. It's right about here. I'm going to listen for a full minute. Then I'm going to assess her lung sounds. You move from side to side, posterior and anteriorly. Go slow. Don't hyperventilate your patient. Here, 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 and then you want to come around to the side for the extra lobe, listening for anything that shouldn't be there. Make sure there's lung sounds in all fields, and you want to listen under the clothing. I'm going to listen to her bowel sounds in each quadrant, starting with the right lower quadrant. You listen for up to 5 minutes, and you listen before you palpate. So here, 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 and here. I hear them. Now I'm going to palpate. Do you have any tenderness? When was your last bowel movement? This morning. Was it formed? Any bowel odors? Okay. How about making water? Are you going to the bathroom pretty frequently? Does it smell okay? Usual color? Okay. So the abdomen is good. I'm going to check for skin turgor, which assesses her hydration. Do that over bony prominences. Check for warmth. Check bilaterally. Cap refill. Make sure it's 2 to 3 seconds, and hers is good. Check for any edema. If she had an IV or anything like that, I would assess it. If she had oxygen, I would assess it. Go ahead and come down the legs. I'm going to check for pallor. Check for edema again. I'm going to check the pulses bilaterally to make sure they compare. Check for hairlessness, coolness. I'm going to do a Hohmann sign. I want you to bend your knee for me. Do you feel any pain in the back of your leg? Okay. You want to check that bilaterally. You're also looking for any swelling, heat, anything abnormal. If you want, you can go ahead and do the pedal pulls and pushes. Can you pull up on my hands? Good. And go ahead and push on my hands. Make sure her strength is equal bilaterally. I would have, while I was up here, gone ahead and sat her up and listened to her lungs in the back. Listen for me. Do you want to? Again, you're checking from top to bottom, side to side. So here, 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 and here. You want to go slow so you don't hyperventilate your patient. You want to look at skin status as you go, and don't forget to look at the booty.
All right, thank you.
That's it. Who's